Thank you so much for everyone who's joining us today for our town hall to really discuss grit and gratitude. I'm so grateful. I'm so grateful to everyone within our organization, the heroic acts I see every day, the incredible work from people from throughout our organization at every level is beyond inspiring. It's amazing to think we just crossed recently our 1-year anniversary. I remember it like it was yesterday, on a Friday night around 10 o'clock, getting the call that we had our first positive patient who was being admitted that evening to Hartford Hospital. And several of us came on site and we had a press conference announcing this. And I remember the gravity of the moment and understanding the significance of what was happening. Later that evening, we went upstairs, Cheryl Ficara, myself, Keith Grant, and a number of people, because we wanted to meet with our colleagues, our team who would be caring for this patient. We went up to the floor, and I remember just being awestruck by the incredible courage of the first group of staff we encountered at the nursing desk. And it was amazing to see many of these staff members were with us just a few years, fairly early in their career. And they had a certain sense of energy and excitement because they felt they were trained, they were prepared, and they were ready to be called into service. And I remember as I walked further down the hall, I ran into several of our more senior providers, one physician in particular, and I remember just the seriousness that she was expressing. To see kind of the mix of emotion that evening was remarkable. And to imagine a year later, the fact that we would ultimately care for 9,500 people within our health system across our different hospitals, the tremendous discretionary efforts, all of the ingenuity, the initiatives that our people would put forward. I've never been more proud of our health system. I've never been more inspired by our colleagues. And I've never been more impressed with the level of excellence that we have, the capability, the technological sophistication that we are blessed to have within our community. Our health system, Hartford Healthcare, stood up, leaned in, and did what continues to do whatever is necessary and possible within this crisis. Often I've described in the last year across Hartford Healthcare that we're built for this. And at the same time, we know as individuals, as humans, that nobody's built for this. Nobody is prepared for a global pandemic. And nobody is ready to see the impacts that this has had in so many people's families, the deaths that have occurred, the impact on people's livelihoods, the impact on people's behavioral health and well-being. But as a health system, when I described us being built for this, my intention is we've spent more than a decade creating a health system that's integrated, that's built with a single electronic health record, that has the capacity and the agility to move our people where it matters most, to move our equipment, to move our technology, to respond to one of the most critical issues within our community. And our health system has continued to display that resourcefulness and the tremendous endowments that we have in terms of talent, capabilities, and people has allowed us in this crisis to do absolutely extraordinary things. I look at the fact that we've created a testing operation that just in the next few weeks is going to cross over 1 million tests that we've provided across Hartford Healthcare. Now, we've provided testing through mobile communities, from homeless shelters to prisons to community centers to pop-up centers and parking lots. We've provided testing centers in hotels, university campuses, to the convention center. What we've been able to do to ensure that we could provide containment support throughout this crisis has been beyond impactful. And this week, we're going to cross over 300,000 vaccines that we've administered just over the last several weeks. It's absolutely incredible to see the impact that our system has put forth to when we can protect people most, our ability to bring the vaccine to people safely and efficiently. The 8 mega centers that we've created that allows us to have a statewide network in every county. The fact that we have 22 fixed locations across the state And again, leveraging our mobile capabilities to standing up vaccines operations now through trusted partnerships across every aspect, of our community. It is absolutely critical. Amongst the many things I'm so proud of, perhaps the thing that's been most impactful is to see the work that we're doing around health equity. All right, we know that there's been disparities in healthcare for forever in many ways, and it's absolutely unacceptable. But it's never been more apparent. There's never been a brighter light shined on it than within this crisis. And our health system is responding. And it's often, as I describe it, we're going to be better than normal. We already are better than normal. And one of the areas that perhaps is going to be the most profound will be the work we do around addressing the inequities that exist in healthcare. I'm so encouraged by the fact that just looking over last week, 35% of the total vaccines that we delivered across Hartford Healthcare were delivered to the 50 priority zip codes that the state established. Right, we're making a tremendous difference. If I look over the last 4 weeks, we've been over 30% of our vaccines to those 50 targeted zip codes. So our system has developed enormously impactful, trusting partnerships within our communities that are making incredible difference. We're partnering with organizations like Food Share. We're partnering with houses of worship. We're partnering with community centers, and it is extraordinarily impactful. So today, events like this, to me, this is about the commitment we've made throughout this crisis around transparency, around ensuring that we as an organization share all of our information immediately, broadly disseminate, and have open lines of communication. So today's an important opportunity for us. And I've invited leading experts across our system to share, have an open dialogue around the issues that are most pressing, so that, again, we have total awareness and transparency. At the same point, we have solicited questions, and we will go through the vast majority of those questions today. And to the extent the question was a very specific area, we will ensure that each question, each person who submitted it, gets a personalized response. So today we have Keith Grant, our Senior System Director for Infection Prevention. We have Dr. Jim Cardin, our Chief Clinical Integration Officer, Sarah Lewis, who's our Vice President for Health Equity, and I'm really excited to have Mandy Richards, who just recently joined us. And Mandy is serving in a capacity as our first inaugural Chief Nursing Officer. So let me first begin by inviting Keith Grant forward to assist us in really understanding where we are from an infection prevention standpoint. And Keith, you've been omnipresent since the very first moment that this crisis came really before it came to this country, as you were studying it carefully, and certainly when it came to Connecticut. And we were together that first night. We were shoulder to shoulder. And I remember walking with you, and we were speaking to several staff members who were asking us, who were non-clinical, about the need to wear masks or not to wear masks. And it always strikes me, we didn't know what we didn't know, and we didn't understand what couldn't even be understood at that point, because this was a new vaccine. Absolutely. Tell me that night when we were having those discussions, what were you thinking, and how does that night kind of reflect for your memory?
So, I think that's a very, very good question, and especially reflecting on what we've done, where we've been, where we are right now. It's interesting because there's a recording of me speaking about around that time. The question was asked, what do I think will happen with this virus? And within that recording, I speak about the fact that I do think this is something that we'll manage very well when it gets to the U.S. And the interesting thing about that, I will always use that because it's admitting and accepting the fact that, what the decisions that we make right now is based on the science and information that we do have. We're in a much better place because we know significantly more with managing these patients. If you look at the mortality rate, that's shifted significantly. If you look at the resources that we've used and put forward to ensuring that individuals have the right information to move forward, and we constantly improve that. So I think much better place, different conversation as you stated before, but there's so much we've learned.
Well, one of the interesting things, in this crisis, it's unprecedented, right? It's a worldwide pandemic. We didn't always know what we didn't know.
Yep.
And, we've said from the beginning, when we get new information, new facts, new data, we're going to be informed by it and we're going to adjust.
Yep.
So just even recently, I know there's a new study came out, a South African study that's just being released.
Yeah.
Can you speak to that?
Yeah, absolutely. So Pfizer, all the pharmaceutical companies are still putting a lot of effort into the vaccine and the trials and so forth. So one of the questions that we get a lot of is about these variances, right? And what the vaccine will do with the variances. Does the efficacy hold up? There's an interesting study. It's not peer-reviewed yet. Very interesting study, very small cohort of about 800 individuals that were within South Africa. And the primary reason why this was used is because the B1351, or the South African variants, is predominant in this area. And from that study, it showed that the Pfizer vaccine had 100% efficacy within this group. Again, I'd be shocked if it's really 100%. It's a very small study, but that's very good to know because this is the variant that we're most concerned with right now. So again, Connecticut has seen only about 7 of these variances. Other variances such as B117 that came out of UK in about December 18th of last year, we've seen about 370, 380 of those variances, of those events, and we're monitoring them very, very closely.
So Keith, speak to the variants. You know, if I've been blown away by the bravery and the courage of all of our colleagues, particularly the people working on the very front lines of healthcare. So when you speak to our colleagues today with these emerging variants, and the notion of trying to ensure safety and ensure that we're protecting our colleagues. Speak to what we know about the variants and what we understand about them and the risks associated with them.
Absolutely. So, you know, one of the things, before we get into that, one of the things I just want to point out, so regardless of what the variance is, the process for prevention is the exact same. Right? So proper hand hygiene, wearing your mask, and social and physical distancing. And if you have symptoms, stay away and get tested as soon as possible. Same exact concept. So variances there's some variances that it seem to be more contagious. So B117 is a variance that we've watched very keenly. In some data, it says about 70% more contagious. Something that we really need to pay attention to. And through Hartford Healthcare collaborative effort with Jack's lab and the state lab, we're able to sequence some of our testing to see if we are seeing those, right? And then there's the B1351, which I talked about. Again, a variance that the biggest concern about this is when it just came out, we started looking at it, it seemed that the actual variance itself was evading, or the antibodies that our bodies are creating after exposure to COVID wasn't impacting this variant as much as it was impacting every other variant. Right. So that was a concern. So the news from Pfizer is exceptionally well welcomed.
How do we test for variants, and you know, how pervasive is it today, and what triggers testing for variants within our institutions?
Well, if we have a cluster, and I'll use that opportunity to talk about clusters in just a minute, but if we have somewhat of a cluster in our community, or if we see multiple individuals coming from a specific area that are positive, then we have to worry, is this something new? Is this a more contagious process, right? And that will trigger having a conversation with the DPH or Jack's lab and say, hey, can you guys do sequencing on these testing? So far, so good. With clusters, one of the good things, and we just talked about timeline. So the last time we had this, we had a number of clusters that we're managing with our colleagues across their system. Right now, we have none. So there's no cluster within our system we're managing right now, which means transmission within the hospital or within our colleague, because we know a lot of this transmission didn't happen within the hospitals or within the healthcare system. It's gone down exponentially, now 0 at this point. So a lot is going well. So a lot of things are going well.
So Keith, when you look at our circumstances today, we had 125 patients today who are COVID positive in our hospitals. In the last 3 weeks or 4 weeks, we've had as low as 82. Interestingly, we've had 82 people. It went up to 114 people. It came back down at one point to 91 people. And today the number's slightly higher at 125 people. 43% of Connecticut people age 16 and older have been vaccinated. And we know that those numbers are rising now significantly as we have more vaccine. I often describe it as a race, right? Yes. And the race is to get the vaccine as quickly and to as many people as we can while we try to prevent these variants from getting more traction and spreading. Can you speak about the race, about your sense of your confidence?
Definitely. And I would rate this a perfect way to look at it. So we talk about how significant the variance is. If we get to what we talked about herd immunity so much, but if we get to a place where it's harder for the disease to transmit, we have less need to be concerned about the variances.
What's herd immunity in your mind?
herd immunity right now needs to be achieved about 75 to 80% of vaccine, right? So if you look at your 75 and plus, 65 and older group in Connecticut, we can conceivably say they're about there, so 82% vaccinated. You start coming down, the rate are slightly different, but I think we're in a much, much better place. Within our healthcare system, if you look at the number of individuals exposed within the healthcare system, if you appreciate 10 to 20% of individuals having antibodies within our healthcare system, plus 65% vaccinated, we're in a very, very good place. So we're in a very good place with most of these epidemiologic key factors. But at the same time, there's still some things that you said before that's very key. So we're in a much better place, but you just pointed out we had 125 people that are in the system that are positive. This disease still there. There's people still dying from it. So very important.
Yeah, from my perspective, that's why I describe we're turning the corner.
Absolutely.
And we are turning the corner because there is more vaccine available to us. We're distributing it extraordinarily efficiently. And at the same time, we're able, I think, to titrate and to win this race. But it does require, Keith, people maintaining exquisite practices around distancing and mask wearing and hand hygiene and even being sensitive to travel. Can you just speak to that piece?
Absolutely. And I know the CDC just came out and talked about vaccinated individuals and travel and how quarantine versus isolation or quarantine isolation or what to do with the two different groups. One of the things that we talked about a lot is risk mitigation. The traveling increase your risk for exposure. So we do know that. There's good data about the vaccination and vaccine process being very, very protective. We've seen the efficacy on it. It's also protective against you spreading the disease. So that's some key factors. It's not 0%. So very, very important. So, with travel, our policy is still according to the CDC. CDC policies, if you're vaccinated, your risk is significantly lower and the chance is much less, and hence there's no need to quarantine. We've had a stand with easy communication to our colleagues and our staff, and keep this in mind. You're increasing your risk with traveling. So if it's unnecessary, I do understand we're at this point that there's a light at the end of the tunnel, and I think this is the closest we've ever been, but just keep that in mind. It's a higher risk.
Let me ask you one final question. Throughout this crisis, so often people talk about statistics, and from my perspective, these aren't statistics. These are people. They're human beings.
Absolutely.
They're people's mother, brother, sister, child. They're members of our community and the people we're entrusted to care for. I was struck when you and I were talking about, just before we started this broadcast today, we were discussing that first night and our respective feelings, and you described that you stayed in contact with the family of the first patient we cared for, and tragically she passed away. Describe from your perspective these types of circumstances where we've tried to ensure that we're caring for people and not numbers.
So the initial conversation with this started the precedence of what we've done so far in this process. So remember, the patient's positive. We're all here from a clinical perspective. We're doing the right thing as much as we know what the right thing is at that point. And you, myself, and Ajay, we had this discussion, and what should we do for the family? Remember, you said, do whatever the right thing is. And the right thing at that point was being 100% available for this family. So we're on the phone at 2, 3 o'clock in the morning and discussing how we can facilitate the epidemiology and the contact tracing for this family, quicker than the DPH. And Dave, we've celebrated a year of having COVID here. They've recognized a year of not having family member here. And we were there and having that discussion with them. So I just spoke to members of the family a few weeks ago when we were celebrating, and just letting them know this is something that we're recognizing right now, and if there's anything we can do to support them. So we will continue to do that. That's what we're supposed to be doing.
It's the right thing to do.
Absolutely.
Keith, I'm so grateful for your leadership.
Absolutely.
I'm so grateful for your discretionary efforts in this crisis have been amazing, and the way that you've leaned in to do whatever we can for our communities is inspiring for all of us. Thank you.
Absolutely. Thank you.
I now would like to invite Dr. Jim Cardin forward. And Dr. Cardin, Jim, you're a wonderful example of there's no rule book for how to respond to a crisis like this. We throw the rule book out when it starts. We do whatever's necessary. And we've had to have a battlefield mentality where we've had to deploy people to where it makes the biggest difference. And it started with you as a leader, as a clinical trained cardiologist, and as a person who has been running our clinical integration organization. You spent the better part of the last year building a testing company, and then building a vaccine company, building a campus cares company for our colleges, universities, and boarding schools within the region, and now really building a company focused around our efforts around health equity. When you took this assignment a few years ago, could you have imagined being in a situation like this, having to have the agility, and what did you learn from getting a chance to work deeper into the organization and see the efforts of so many of our colleagues?
Yeah, I had no idea that I'd be involved in this, and being given this opportunity was just, in many ways, I've said, as much as this nightmare has been difficult, it has really given me a sense of great purpose, and has really sustained me personally through most of this. What has been incredible is the ability to work across the organization, give people an opportunity to step up in addition to their regular jobs and kind of get this done. And the ability to take what normally you'd think of could be weeks to say, we've got to have this done by tomorrow morning, and watch the team come together, organize themselves, get the appropriate folks involved to make rapid decisions, do the right thing, make sure we have everything buttoned down, and then to be able to do this has just been reaffirming is how agile we can be when we have the focus of what we need to do and when we need to do it. And the hundreds of people who have been involved in this just shows you how capable our organization is as you go deep.
Jim, one of the things I'm really, really proud of within our system is, our system grew during this crisis because we hired nearly 1,000 people into the organization to help us vaccinate, test, and man our community-based operations that we created. But the people who were working here full-time or even in other capacities and volunteered and said, I'm going to do this. And what they had to go through, particularly when there was such uncertainty at so many different levels,
correct,
right, is incredible.
Two things is agreed. They also were venturing into the risk place. You're going to be interacting with people who are likely to be infected. So taking that on. The other part of it that was so important is our own people being able to embed a culture through those that had never worked for Hartford Healthcare. And yet you saw it over and over again, the experience that patients or people had said, all these people seem like they're just part of what Hartford Healthcare has been and adhering to all of the values that we hold dear. And that's because our folks embedded that in the people who really didn't know what to expect when they got here.
So describe, last Friday, we did 8,000 tests, or 8,100 and change, to be more specific, vaccines rather. That's an incredible feat to be able to do that. And also last week, we pioneered, first organization in the United States, and we pioneered 10 days in Bridgeport operating the FEMA van for the federal government and helping them pilot it with us. Describe what you're seeing in terms of our ability to deliver vaccine and our ability to deliver vaccine to these very targeted and specific communities where there's greatest vulnerability and risk.
I think it's really, it's interesting. If you look at what we did with testing, we had to build out a couple of parallel processes. One, to be able to do this in a mass scale. We had to be able to do a lot for a lot of people. But we recognized fairly early that there were people that we weren't reaching, and developing the capability of having the community relationships to bring us into the community so we can get to the test of those smaller populations that were vulnerable. And I think we've had to really double down on that as we go forward. So we were prepared to say, okay, we're going to need to just do a lot of people quickly, but at the same time, we can't lose the relationships we have, and we have to accelerate them even more. So our ability to use community partnerships, those relationships we've had to bring vaccines to the people has been critical. That partnership extended beyond what we did even with testing as we work with the state, we work with the local health departments, we look with community leaders. We listened to what we need to do to get to what they knew, because I think a lot of times we often assume we know what we're supposed to do, but we really had to pay attention. The FEMA van was exciting. In the days meeting a very small community, trying to focus it on just the Bridgeport community, we did over 2,000 vaccines in the week or so that we had it to begin with. Have a couple more days with it before we move on.
Jim, when you think about what we've done on vaccines today, the rate limiting factor has been the number of vaccines we get from the state each week. And we've often said we're built to do about 80,000. And I've told the governor numerous times, if you give us 100,000, we'll figure that out too, because it's just simply what's needed. It's the right thing to do.
Right.
Today, what are you seeing on the front lines of our ability, as Keith Grant was describing, if we need to get to 75% of our community vaccinated? What are you seeing around vaccine hesitancy? What are you seeing around our education and communication efforts to get this vaccine accepted?
Yeah, I think that I think it's still mostly we're limited by access. In other words, the number of vaccines. We are undoubtedly going to run into some of that hesitancy, but I think it's already starting to kind of fall away. Mm-hmm. The more experience people have, and they have their friends, neighbors, and otherwise get vaccinated, the more it brings confidence. I think this is where the community relationships become clear. When we have community leaders that stand up and say, I'm getting vaccinated, you should too, it brings confidence to those who are concerned. We do have an obligation to continue to inform. We want to make sure people are making a very informed choice, and then make sure it is entirely available when they make the choice to get a vaccine, and that's the goal we have.
So, Jim, when you look at the decision we made early on about using our own information system, using our Care Connect and our version of MyChart to register our patients. We had to build a call center specific to Hartford Healthcare to do that. Describe that decision, the impact of that decision, and what has resulted because we made that decision.
Yeah, it was as you know, there were various processes that were being put forth to try and schedule and maintain this, and we made the decision to use the tool we had, Epic. But in reality, it wasn't built to do this. Epic was really not built to be a patient-facing administration tool. And so we had to really work hard with Epic, with our IT folks, and the clinical people to make sure that we were using the tool to both provide a way for us to get people in an organized way to schedule and come in for vaccines, to make sure that we were following that up both clinically and getting their second dose because of the logistics around that, and at the same time trying to remove the typical barriers that sometimes occur as you're coming in. And so having multiple ways for people to schedule became an important part. Not everybody has the technology, either know-how or the devices to necessarily do the way we work. What that allowed us to do is we now have a way to use that technology to really, as opposed to having everybody keep coming in and trying to schedule, to outreach to them proactively and let them queue up electronically so that they know they're on the list, and we will bring them in as we get vaccines available, which decreases the stress of having to search for an appointment.
You know, you highlight a very important thing there. When we started this crisis, we had somewhere between 500,000 and 600,000 people registered in Epic and MyChart. Today we have more than 1 million. That's a tremendous opportunity. That's about being better than normal, because we now have a capacity to communicate around health, wellness, prevention, intervention for their health care with a significant portion of the state of Connecticut. But the last point you made, this notion of outreach, was one of the great innovations within Hartford Healthcare, that we have a technology that allows us to immediately send out to every cancer patient how you can get your vaccine.
Correct.
Right, so just describe that piece on the outreach, because this is going to go forward to be critical to how we care for more people.
It's one of multiple lessons that we learned. And what we have the ability now is when we're trying to prioritize and outreach to people, not waiting for them to raise their hand, but we can ask them, remind them, and say, if you're willing, we have an appointment for you if you're needed. And so therefore, they're not waiting to be contacted. We heard some of that. There was an elderly woman who sort of said, I was just sitting here waiting for somebody to reach out, when most of us had no capability of doing that. This allows us that capability. It starts with vaccines. It rolls into a whole lot of other things that we can do to engage and make sure patients and people have access and know how to get the health care they need.
So, Jim, my last question. Innovation is a hallmark within Hartford Healthcare. We have tremendous ingenuity across all of our colleagues, and we're an organization who doesn't ask why. We ask why not. We challenge ourselves to think differently. Just in this week, right, we're pioneering vaccines being delivered within our emergency departments to patients leaving the emergency department. All people leaving our inpatient as they're transitioned to home or to skilled nursing or home care, they're going to be receiving vaccine. We're also looking to pilot it in behavioral health for all of our behavioral health patients. Describe what that type of ingenuity, that sense of innovation that you've been so close to, what it means and how it's been so relevant during this crisis.
What's been encouraging is you've liberated people's thinking. They are no longer burdened by saying, well, we got to go down this path. They say, well, why don't we do it this way? We know in healthcare, we do a tremendous job at providing care in silos at times and in individual places. But there's so many opportunities for us to just get better. And this entire pandemic has just revealed where we have what we thought were cracks, were more gulfs in our delivery system. How do we build to fill in the gaps? How do we build so that we're not just saying this is the way we do it, but why are we doing it this way? We could do it another way better. And each of these things, vaccines are just a nice solid example as to where we can say, well, we never did it before. Why? No good reason, just we didn't. Now we do. And that is going to continue to challenge us and allow people to really let their thinking go.
That's the momentum we have to capitalize on, and we have to maintain that sense of ambition and that sense of energy, around being willing to try new things and do it differently. And if we're going to fail, we'll fail fast, we'll learn, but we take some calculated risks. And I think we've repeatedly done that in this crisis, and that takes leadership.
Absolutely.
So Jim, I'm really grateful for your leadership and your team and the colleagues who are working with you. The work they're doing, truthfully, on the front lines it's very, very hard to even describe it. When you see it, it's amazingly inspiring.
Well, it's been a great opportunity. It's humbling to watch all that they can accomplish.
Humbling's the right word. Thank you, Jim, Dr. Jim Cardin. If I could, I'd like to invite Sarah Lewis forward. Sarah is our Vice President of Health Equity, and Sarah has provided critical and essential leadership in a moment within our history where we have one of the greatest opportunities that may ever present itself. Sarah, welcome.
Thank you, Jeff.
And I'm very grateful for your leadership. I've described it as that these are inequities in healthcare that have existed for a long time for many reasons.
Yeah.
And in many ways, we've attempted to address them historically in different ways. What makes this moment different, and what gives you optimism on why now we can make real structural, sustainable change?
That's a great question. Two things. One, sort of a before the pandemic commitment that we made as a system, and then two, just the strength and the agility with which we responded to the crisis. So, as you mentioned, prior to COVID, Black and Latinx communities and others were already in a crisis of sorts when it comes to health disparities. But Hartford Healthcare had already established a Department of Health Equity, right? We were already building out our team. We were already taking a hard look at those disparities. We were already talking about the chasms in life expectancy between neighborhoods that are just miles apart from one another. So we knew that was a crisis, and we knew that COVID would opportunistically take advantage of that, and that some of the social and structural determinants of health that make those communities more vulnerable to sickness and other chronic diseases would make them more vulnerable to this emerging pathogen. But what I have seen and what makes me optimistic about what goes forward and the momentum that you were just talking about our system building is the way in which we have looked at the truth of this moment, in every single moment, and said, okay, the model that we had needs to change and needs to change now. Let's go out into the community and bring testing where people are. Let's go back there week after week, month after month. Let's ask people, where should we go? Let's listen. Let's ask for advice and then also follow their advice when we get it. We've talked about what it means to build trust in a community and for communities to trust us, what makes us trustworthy, and it's doing what we've done in the last year. It's asking how we show up and how we can keep doing it and listening to folks. And that's what's going to give them the confidence that beyond COVID, they can trust us to take care of themselves.
So let's just stay on the trust theme for one moment.
Yeah.
We've often said we're not going to solve these issues alone. Right? We have to play a very central role because of who we are and because of the great capabilities and resources we have. But we have to do it in partnership.
Absolutely.
And we have to do it with people who are trusted, respected, embedded within our communities, and who could serve as our partner to do this. Describe these, what that partnership has meant and what it has proven during this crisis and how we can leverage it going forward.
I think immediately you mentioned food share earlier, and last week we were at the New Britain YMCA helping people who were online waiting for a mobile food distribution to either sign up for a future shot or get a shot right then and there at the YMCA. We're talking about essential services, healthcare and food, and they're so intertwined, right? There's no stark line between one and the other. They have core expertise, we have core expertise. We can merge our respective levels of expertise, so we're not recreating the wheel.
And Sarah, use that example. Why couldn't we be doing diabetic screening or
Exactly.
bariatric, assessments?
Yes.
Fill in the blank in a service.
Exactly. Yes.
Right? That's what we have to do.
And they're an innovative organization as well, in that they actually do research on their client population, so they understand what are their immediate needs that are health related that we can meet, that can meet them where they are, and while they're meeting their food insecurity needs.
So one of the things you've brought most to our organization is a very sophisticated, methodical, proven approach to how we're going to address health equity. And you use data, and you have data scientists, and we're not simply going on perception, but we're studying where and how we can make the differences that will matter most. And one of the areas that has become apparent during this crisis is the notion of transportation.
Yeah.
And how that's so. Talk about the ride share initiative that we're looking at, and how.
Yep.
One level we can bring care to people, but not in every instance because of the nature of the care. So how does ride share work?
Yeah, so that's another great example of an initiative that was in flight prior to COVID that we can now leverage and expand for this particular moment. So the Ride Health platform is something that when someone calls into our access center for regular appointments and our CCC for vaccine appointments, can call in and say, I don't have access to transportation, I want to come to your vaccine clinic and get care, and we can connect them with a ride, and we pay for it. There's no out-of-pocket expense to them. To and from, it's completely covered, and that is it's a health equity play, so to speak. It's good for us in terms of on the access center side, keeping people coming back to regular appointments where they need to get their conditions cared for. But in this particular acute moment, it really helps us reach that goal of health equity and racial equity in the way that our vaccines are distributed.
Which is absolutely phenomenal.
Yeah.
Could you speak for a moment on a macro level, at the state level?
Yeah.
You're also spending a meaningful amount of your time advocating. And the state, the federal government, both are going to play important roles on how we address health equity. And we're going to use our platform, from public policy perspective, to work to influence policy.
Yes.
If you had to say, what are the one or two things in particular that we should be advocating for, that we could educate all of our colleagues to be aware of, that would make the most difference, that from a Hartford healthcare perspective we care about deeply?
So I'm really encouraged that Connecticut right now has a bill in front of the legislature to declare racism as a public health crisis, and you boldly took the step to do that earlier this year, and it's essential. It helps. It will also create a task force on the issue of racism in healthcare, and it will bring together experts that will put this issue front and center when it comes to one of the underlying and known conditions when it comes to sort of the pre-existing conditions within our communities when it comes to health disparities and health equity. So that's something that I think our colleagues can learn about and ingest and spend a lot of time thinking about how we can make the difference that we want to make. And the other one is continuing to look at bias and understanding how the role that bias plays in the way that we interact with one another as colleagues and the way that we interact with our patients in our communities.
So two things we're doing today, right? We're going to be doing implicit bias training, across all colleagues will be afforded that opportunity across our system. It's important to our culture. Yeah. And secondly, we have begun and launched a number of colleague resource groups.
Yes.
Which when I attend them, I'm so thankful we're doing it. I only leave thinking, why didn't we do this a long time ago? Sure. But can you describe just those two initiatives that are well underway, so we could all anticipate what's going to be happening? Absolutely.
It's really exciting. And again, kudos to you and the cabinet and our strategy and planning team for making this part of our balanced scorecard this year. This is the strategic commitment that we have as a system for the better than normal going after this moment and all of our moments. But when it comes to the bias training, we are going to be rolling that out, starting with senior leadership, knowing that when we roll out training programs that are expected to have a really big impact on the way that we interact with our patients and our colleagues, we need our senior leaders to know what it feels like, what what it looks like, so that they can teach, coach, and mentor their colleagues. So that'll be rolling out over the next few months, and throughout this fiscal year and then beyond. This first year is sort of the build year when it comes to bias awareness and understanding what it is. With our colleague resource groups, as you say, what an incredible just asset for our system.
Amazing.
Those meetings are full of heart and vulnerability. We've got some fantastic executive sponsors and chairs.
And they give people a voice.
They
on a
absolutely
platform.
do. They absolutely do. And it's so important for us to know that we're there for one another, especially right now. Our Asian American and Pacific Islander resource group kicked off last week, and it was emotional for me, and I know for others in the room, just to be able to see one another and hear one another's voices, and just have that moment.
And sooner than later, we're going to be in the room together for those meetings
We
and
will.
in person, which will make them even more impactful. My final question to you is, I've often described the focus around health equity, our efforts around diversity and inclusion, that this cannot be a moment. This has to be a movement.
Absolutely.
Explain what it means to be a movement.
Now you're talking. I mean, that's my favorite thing to talk about. I think of this as table stakes, Jeff. I think of this as just the way we have to do business. I think that dismantling structural racism in healthcare just has to be the way we work, and that it sends a message to our colleagues, and it sends a message to our community members and people in neighborhoods across the state that we're going to meet them where they are, and that we are going to trust them to tell us what they need, and that we're always going to listen to them. So it's everything. It's the way we do quality and safety. It's the way that we design the way that our buildings flow. Giving people access, thinking about ability and disability, thinking about language. It's everything.
Language, right? A big area of focus for us today.
Yes, absolutely. Yeah, and that language access is expanding, and we already offer so many different translation services, but it helps. I think it's when we put our badges on or our pins on every day in the morning, we know that equity is part of who we are, full stop.
Sarah, I'm so appreciative that you're here, you're leading this effort with us, for us, together.
Thank you.
And the fact that you've built the team that you have, who wake up every day and go to bed every night, advancing this in our organization. And it will be a movement. We are making a difference. We will make a bigger difference going forward, and we're going to hold ourselves accountable. We're going to look at results, and it will be data driven. And when we look at, in particular, the issues around health equity, there's an imperative. It's the right thing to do, and this is the time to do it. So we are really grateful for what you're doing to drive this here.
Thank you so much, Jeff.
Thank you, Sarah. If I could invite our final panelist, which is Mandy Richards, forward. And Mandy is our inaugural Chief Nursing Officer, who has just joined us in the last several months. And Mandy, we're really grateful for you joining us. Mandy comes to us from the Allina Health System, where you were for 15 years in Minneapolis. And I describe it as you were being prepared for this moment at Hartford Healthcare.
Absolutely.
So just tell me, coming into our system, you came here in this moment, well into the crisis. First impressions.
First impressions. So, nurses have always been a trusted voice in the community, but never more than in the last year have we really seen that. And so the first thing I thought that was so amazing was that even before the pandemic, Jeff, you had prioritized this role of elevating the voice of nurses within our organization. And as you think about this was prior knowledge to the pandemic. Now, as we think about having moved through the pandemic, the voice of our nurses is so important to make sure that they're involved in every part of our decision making. So a huge credit to you.
And at the highest levels.
And at the highest levels. And so the fact that you had already addressed that and prioritized that at Hartford Healthcare was really quite telling. And so just a huge credit to you, because you really do value the voice of nursing, and I know that. And so I'm very, very excited to be representing the nurses.
Sometimes people will say, why now? And to me, it's a great question, and it's a judgment. There's never a perfect time. But I felt we're ready. I think we're more than ready, because we did a lot over the last few years of putting Epic in place and having to adapt our practices and integrate the system to support a single electronic health record, and all of the work we created around really our values and becoming a health system. To me, this is the next level, and this is the what's so exciting, because we couldn't do what you're now prioritizing as our agenda for nursing until we were integrated at a certain level. So tell us, what is that agenda? Like, what are those
Yeah.
2 or 3 things that people say, what does the chief nurse, what is Mandy going to lead?
Here's what we need to do. So I've been spending the last 90 days getting out and speaking with our nurses, really understanding where is the best practice across our system, what matters most, what can we share across our system where we're doing it really well in one site, and how do we translate to other sites. So as I've been going around the system, I've really been keying into what is important, and really what it is to elevate the professional practice of nursing. So a lot of people say, well, what is that anyway, Mandy? So what that means is having nurses have a voice in the changes of care delivery that will affect them. And by doing that, they have more of an understanding of the clinical components of care that they can contribute to and the outcomes of our patients. And when we do that, we will have improved clinical outcomes and patient experience. So that's the first thing. The second would be, we really have to look at how do we look to take out the variation across our health system. And the reason why that's important is if I was a patient that was going to Bacchus, say for stroke care, there should be the same level of expectation and outcome that I would have there than if I came to Hartford Hospital. And if we don't have that seamless, standardized care that we deliver as nurses, then there's going to be high variability amongst not only the experience, but also the outcomes that our patients will have. So those are the two key priorities. And a third one I would add would be, how do we ensure that we're supporting our nurses at the bedside? Right. How do we make sure that as new nurses are coming in, that they are given the mentorship they need, the training they need, the opportunities to stay at Hartford Healthcare because it's the best place to be a nurse. So they can continue to grow in their career, that they can move from a med-surg unit into a specialty of interest to them, that we support them along that continuum. And if their desire is to become nursing leaders, that we prepare them for that and we support them in those roles.
Absolutely.
Yeah.
When we have a premise, within our system that we truly believe everyone within our community deserves world-class healthcare, period. And we have the resources to deliver world-class healthcare, and we are able to develop programs, and we're demonstrating results that are exceptional. And one of the areas we're focused on is our leapfrog rating, which is a composite of a number of ways that quality is assessed and measured at a governmental level. And our health system recently crossed over to a new level of achievement, now having all A's and B's, which really puts us amongst the very top health systems in the country. Very few have where every segment of the system is at that level. So when you look at our system today and our ambition to have all A's, to truly be in the very top of the top 1% in the country, and to have our community know that, to know when they enter any one of our 453 facilities, that's what they should expect. Is it achievable?
Yeah,
Can we do it?
As I look at this, for nurses play a big part of that, Jeff. We've got over 7,000 nurses. You think about that. When we talk about every single nurse owning their professional practice, that's how we'll achieve all A's. So as I think about it, nurses are so integral in the part of the clinical care around falls, around pressure injuries, that all lead into that leapfrog score. How can we ensure that each and every nurse knows what work needs to be done to ensure we get the outcome? And so as we really have collaborative governance structures across our health system, which are groups of nurses working together at the unit level, at the hospital level, and at the system level around quality and safety, around nursing practice, that's where we'll really, it absolutely is achievable, and we've got the right structure, and now it's really utilizing those structures to get those results.
That's why it's so
exciting.
Incumbent upon us to get to never events.
Yes,
Right? We know
absolutely.
that when there's things occurred within our system where there's breakdowns, right, it's process that happens.
Yeah, absolutely.
And how do we develop a culture that ensures that that doesn't happen, can't happen,
Absolutely.
And develop better processes? So when you look at our system and you think about the variation, that exists, it would be expected to some extent.
Absolutely.
How do we create a system to start to eliminate variation so we do have the best practice installed across the system?
Yeah, I think where it starts with trusting relationships. So whenever you're trying to bring a system together, it's all about change management, isn't it? And so it's really, you have to develop that component of trust. So one of the things that I identified early as I came into Hartford Healthcare, it is a very, very unique culture. And by the end of my first week, I was trying to put my finger on, why is this so different? I've worked in healthcare for over 20 years. Why is it so different here at Hartford Healthcare? And then I finally realized it's the leadership behaviors. And so for most leadership behaviors, all organizations have them, but they're in a lovely framed picture on the wall in a conference room. It's never really lived. And so what I saw in the first week alone, which shows me it's embedded in our culture here, is I saw people being in the moment. I saw people using discretionary effort. I saw people having the ability to look in the mirror first, so to think of, okay, what could I have done differently? They were having transparent and honest conversations. And when you have that, you have a sense of trust that's built. And they always talk about the speed of trust. When you have trust, then you're able to go further and faster. And that's how we really start to come across the system together.
So just building on that, when you talk
Yeah.
about trust and transparency, but it doesn't mean everyone's going to agree with every decision.
Right.
But it does mean that they're going to trust that the decision is being made for the reason somebody said it was.
Absolutely.
And they still could completely object to it as a bad decision, the wrong decision, but they'll understand the why behind it.
Yeah,
and the
absolutely.
transparency around it doesn't mean that everyone's going to agree, again, on the issues that are being discussed, but they're going to know those are the real issues. So from your
Yeah.
perspective, and as you sense as an organization, trust and transparency, how do we embed that so that we can create confidence in an organization repeatedly around trust and around the fact that there's great transparency?
I think it's all about being open, isn't it? It's being open and not defensive, being vulnerable, and really being good at communicating, calling it out, saying, I know that this is not necessarily where everyone landed or what everyone was thinking. I think within nursing and within medicine, we always look to the evidence, and so we're very scientifically driven. So looking to the evidence does help us as we start to try and do what is right, what is best practice. But I think sometimes it's the communication, Jeff. It's calling it out in the moment, knowing that as we always work on the premise of we do plan, do, study, act. We learned that in nursing school, and adjust, so that we may not get it right the first time, but we won't be the culture of innovation as you talk about unless we continue to go, we're not going to get it right the first time, let's make sure we try something and then readjust. And so that's how you get everybody on board, even if everyone's not a true believer at the beginning.
I'm really grateful for you being the inaugural Chief Nursing Officer for us and your commitment to helping us drive our quality agenda, because we will be, we already are in so many ways, and we will be a national example. Our community deserves it. So we're very grateful. If I could, I'm going to just bring forth some of the questions that were submitted and ask some of our panelists to speak to the different questions, if the panelists can come forward as we work through some of these. And again, to the extent we can't get to every question, we will make sure every question is responded to as we go forward. I'm going to start with the first question that was just handed to me. The question is about, and I think Jim Cardin probably has the statistic, and perhaps Keith. Within our colleagues today across Hartford Healthcare, how many of our colleagues have been vaccinated?
So we are at about 65% of all the colleagues have been vaccinated and continue to make progress sort of week over week.
And Jim, the second question, related but probably not perfectly related, will I need a booster?
It's a great question. Unknown right now. We anticipate, as Keith will could elaborate on, that the vaccine will continue to emerge and change. That's the nature of vaccines. Vaccines do what they do, which is continue to change their form. Whether we're going to need a booster and when will determine as we understand the science. We just don't have enough time. We do recognize now that at least 6 months seems to be at pretty good coverage with our vaccines. And then we have to see what the variants and the effectiveness of the variants will tell us whether we need to have yearly vaccines or otherwise, depending on how that all plays out.
And as soon as we know anything, we're going to share it.
We'll be ready. So that when we need to administer, if we need to do boosters, all that, we'll be ready to do it.
Great. Keith, please come forward. 3 quick questions on travel. We got a number of questions on travel. So the CDC guidelines, the advisory that just came forward for fully vaccinated people, with the summer coming, with so many members of our colleagues being restricted from seeing their loved ones, their family, what are we saying today? And please be clear on travel.
Yeah, absolutely. So I will say whatever it is and however we decide to share our summers with individuals around, do it safely. I think we've managed to create a number of infection preventionists in the communities over the last few months. So people know the right thing to do, I think. As we talked about before, the disease is still here. The virus is still here. Dr. Cardin just talked about the evolution of variants is developing, so just be very cautious. According to the CDC, if you've been vaccinated, you're allowed to travel domestically without being quarantined. So that's clear. And or the HHC's policy is according to the CDC right now. So we continue to monitor and provide resources for our colleagues to be monitored. But as it stands right now, policy is according to the CDC.
Question, Keith, that came forward also. People appreciating Dr. Cardin just indicated we're 69% or so of people here working here who are vaccinated. And again, that number can be a bit deceiving based on per diems and kind of the totality of our workforce. If you look at segments of our workforce, it may be much higher.
Absolutely.
But the question is, what's HHC's position on mandating the vaccine?
So this is a conversation that is new in the sense it's new publicly. So it's a conversation that we've been having for a while. Obviously, there's some challenges. There's a number of challenges. Obviously, the vaccine is still EUA, so that's one challenge. Emergency use authorization. It's not a full FDA approved.
But some systems around the country are mandating
Some systems are at this point mandating the vaccine. So it's been mandated in a few systems across Texas, for example, that are looking into it. That has put it forward. And there's a number of systems in the Northeast, to include in New York City, that is looking at putting this in place as well. This is, I think, this conversation, the conversation that needs to be had on stage and forums such as this, to include conversations and communications from our colleagues as well, because this impact them, significant impact. So it is something that we need to look at. We definitely need to look at whether the direction we choose, we need to be able to say we choose this direction because of.
So to be clear, we don't have a position on it today. Would you say it's going to be considered as there's movements across the country, but it's not something that's immediately happening here? Well, it's going to be looked at and considered as we study the country.
Absolutely.
Next question that came up, somewhat related, is around the vaccine potentially impacting fertility.
Yeah, so there is a number, whenever we do these forums, there's a number of questions I get on this. And, one of the things that we've tried to really redirect people to is the actual data itself. So pregnancy itself is an exclusion criteria. It was an exclusion criteria for all the studies, so Pfizer, Moderna, and for Johnson & Johnson. Within the Pfizer study, a number of individuals got pregnant and did very, very well. They still got monitored. They were excluded from the study but was monitored, did perfectly fine through the process. We've also seen the first individual registered of seeing passive immunity to the actual born baby. So we know, what we do know right now from very small amount of data, that the impact, if any, is limited to none, right? And we've seen from the American College of American Pediatrics have come out and said that if you are at any risk, you should consider taking the vaccine. So I think you need to have specific conversations with your providers. We don't believe it should be an impact based on normal antibody reaction in fetuses in pregnancy. We don't believe it should be a problem at this point, but have that specific conversation.
Absolutely. Urging people to speak to their own caregiver.
Absolutely.
But certainly the American College of Obstetrics and Gynecology is a leading voice in this space.
Absolutely.
And has recommended it up to this point.
Yes, they have.
Question around people wearing masks. If I work in a department, I have 6 people in my department, we're all vaccinated. Do we have to be wearing a mask? Can we be together without a mask?
Yeah, so I could, from the policy perspective at this point, you can't, right? And from a science perspective, based on what CDC has said and what we do know so far about transmissibility after vaccination, after the 14 days of vaccination, and your ability to actually get the disease, they significantly decrease. From a science perspective, there's room for us to start having these conversations, which is a good place to be. But there's still so many individuals that are not vaccinated, and there's still some increase in risk that's affiliated with not wearing a mask, that we still need to be very cautious, and we'll be keeping this in place for a while.
So it's too early.
Too early.
But we're watching it carefully.
Absolutely.
And when we're obviously we're going to move when we can.
Exactly.
But we can't today.
And one of the key pieces of this, just to go back to the initial question, right? The initial conversation that we had. When it's time for us to have this conversation, it's very important for individuals to have that ticket, which is to be vaccinated. So it's very key.
Do you envision people? Another question was, departmental, societal meetings, professional association type meetings. Can people come together in large rooms wearing masks and have on-site education, or are we going to be Zooming it, which I'm not a huge Zoom person. Is that going to be, how long is that going to happen?
That is changing very, very soon. So that is changing very soon. So we have enough data now. There's a wonderful study that was done in Mass, and it looked at students 6 feet versus 3 feet. So that's a conversation we need to have as well. I can tell you the key piece of that study is mask compliance. So with these students, there was 100% mask compliance across the actual cohort of the study, which is very, very good. So which tells you with the appropriate PPE, we could start having a discussion. Not only many more people in the room, 6 feet, but we could probably start looking at probably 3 feet as well.
So we're going to look to sanction some of those things
Absolutely.
going forward.
Absolutely.
If I can ask Sarah to come forward for a quick question. Sarah, this question was around that people are very pleased with our efforts around English and Spanish, and particularly the work we're doing around Spanish, and I'm very proud of that as well. I mean,
Yep.
we're leading the way and making permanent changes around how we can communicate.
Yep.
But this particular colleague of ours said if they found it difficult obtaining other languages, and it can be challenging at times because they see many people who have many different dialects in different native languages. So how would we? What are we doing to get to the root of that issue to ensure that every person we care for, we can communicate safely with?
Yeah, it's a great question. So for now, we do have our ITA language translation services that we can just call up, and they have, I think, over 100 languages that are available. And I'm not sure which languages the questioner was asking about, but I'm pretty sure they're covered there. Additionally, I know that there's work going on across the system to identify colleagues who are bilingual and get them certified to serve as translators for patients as well, and to not leave the burden on a family member or a friend to serve as a translator.
Very good, thank you. If I could ask Jim Cardin and Keith maybe to come forward. This question is really about the preparations for future pandemics, and you know the question I hear in the community most is like Ebola and the risk of Ebola entering our country. But what would happen? You know, are we going to have a pandemic preparedness committee? Are we going to, you know, how are we going to stand down our operations? Or are we going to maintain operations, appreciating that this could happen again in different ways? Please.
No, yeah, let me step out and let you go.
So I could start by saying yes, yes, and yes. I think you kind of answered the question. So yes, so obviously this isn't, what we've learned from this is you can never be too prepared, right? And with your leadership, we're able to say one of the biggest challenges we've had is PPE. That's not a challenge right now. So we're in a very good place. And then
I think that's an important point. You know, we have $50 million of PPE that we bought and are storing in new warehouses that we acquired during the pandemic.
Absolutely.
And today we have a 365-day supply, so we've come a long way
So
there.
absolutely. So not a conversation, not a struggle we should have, and that we owe it to our colleagues because the commitment that they've and faith that they show in us in order for us to provide the support to them. The other really key factor into it is, you know, we look from an infrastructure perspective. Hartford Healthcare is one of the only institute within the Northeast that has the capability and approval to actually care for an Ebola hemorrhagic disease patient, right? Is our infrastructure, even though we have the approval, or do we have the capability? We definitely do have the capability. So we have the infrastructure. Conversation, in regards to conversation, some of the other challenges is in regards to, you know, actual training. So actual training and communication. So we have a number of people that are trained and ready to, if we do have a patient comes on board. But another key thing that we looked into in where PPE is concerned, we had very specific PPE for Ebola. And what our concern is if we do have an outbreak within the country, those specific PPE will start getting very high demand on. So we're looking at redesigning our program to facilitate PPE that we have within our 365 days. So it's much more user-friendly, and it's significantly more agile for us to
Those are the lessons we've learned.
Absolutely.
Dr. Cardin, if you could please come forward. Two questions. First one is, why can't we give supplies of vaccines to nurses and send them out to businesses, farms, homes, etc.? Can we do a better job using people to get the vaccines out to you know, more individual kind of customized locations?
Yeah, and we're doing some of that right now. So as we look at them, what gets most of the attention is the large sites. But we are, in our mobile, we are doing that. We're bringing it to individual communities and showing up and vaccinating. Our home care company is currently vaccinating homebound patients as an individual.
So important. I'm so proud of that group, what they're doing.
It is remarkable. And it's less efficient, but as we get deeper into this, we are going to see ourselves doing more and more
when
of
you
that.
think about that person who's homebound, right? They would have no other way to get vaccinated and to protect them safely. This is the way to do it.
Correct.
Second question, Jim, is around for our colleagues for a testing clinic. people who want asymptomatic testing on site at our different institutions.
Mm-hmm.
So how are we advising our colleagues who need testing in our different locations, who would want testing? How do we do it? Where do we do it?
So we, as where we were during the height, we really had ongoing surveillance testing and targeted testing happening in all our facilities because of the prevalence of the virus, and making sure we're sort of surveying. As we've been vaccinated and we see that declining, having those resources is not an efficient way to do it. It is absolutely available for any colleague who wants to be tested, can go and get tested. We just go to one of our testing centers to make that. So a little less convenient, but always available.
And do you think that we're doing it the right way today, or should we be looking at something different?
No, I think that the two things that we need to do is provide it easy access to make sure it's readily available, doing the targeting under the direction of infection prevention when we have to survey or we have an outbreak. That allows us to control exactly when and where we're testing.
Yeah, so the next question that came forward, and it's one that I'll speak to as well. There were a series of questions that came from people about working from home and how we plan to, what the workforce of the future looks like as we go forward. And, this is a very pressing issue, across society today. And admittedly, I'm a believer in the vast majority of circumstances about people working together, because it's about our values, it's about our culture. It's about the very special thing that happens when people work shoulder to shoulder and are able to stimulate new thinking, new ideas, and the spontaneity of the creative innovation that comes from it. The vast majority of our workforce has stayed on site throughout this crisis, and it's out of necessity, and there's great solidarity that comes with working in healthcare. In some select instances where it wasn't safe, we do have segments of our workforce that and some of the kind of back office functions where it was safe and necessary to work from home. And look, I think we can't probably have a blanket rule in place right as time goes forward, because there may be areas where there needs to be some exception, where it just makes most sense. But by and large, in most instances, I imagine our people are going to have feet on the street, are going to be present across our state and our region, and are going to be working together when it's safe to do so. In those areas. So it's something we have to continue to monitor, and we always have to continue to pay attention to what's happening around us environmentally. But I know it's an issue that people are looking at very closely. It's something we have to take very seriously. But I just, my natural personal perspective is, I walk into places like our Access Center, on 100 Pearl Street in Hartford, and I see the collegiality, and I see the way they stimulate one another, and the way people are idea generating, and the enthusiasm, and the passion, the shared sense of commitment to our values, and I would never want to commoditize that. So I think we have to look at it carefully, and like I said, there will be, I'm certain, probably some exceptions, and certainly safety first, as we make those decisions.
And Mandy spoke to it, right? The culture that was so apparent to her. We talked a little bit about as we brought all this workforce in as per diems, yet they perceived our culture. That's interactions that need to happen in person.
Absolutely. We did receive a number of questions about Fairfield County, and about, we've now been in Fairfield County for a year and a half. We're so grateful to the team. First of all, the team who specifically works at St. Vincent's. Fairfield County was on the leading edge of when the virus came forward to Connecticut. It's been such a tremendous affiliation and alliance, and our colleagues within the Fairfield region, to me, are so perfectly aligned with our values that it's been truly exceptional. We are making great progress in that region, and we're putting together the ecosystem that makes up Hartford Healthcare. So our medical group is building primary care and urgent care. Our home care division is dramatically expanding home care, our behavioral health capabilities, our outpatient rehabilitation services, our surgery centers, our imaging centers, all being organized and integrated within our acute care operations to create the capacity to be most trusted for personalized, coordinated care. And that's our vision. In the first year and a half in Fairfield County, I couldn't be more pleased with the progress we've made. And at the same time, we're not satisfied, because we know we're going to be tremendous difference makers there, and the community is going to get more high, reliable care, higher quality care, better outcomes, better access, and more affordable care as we mature the Hartford Healthcare model of care, the way we deliver our system of care as we go forward. So there were a number of questions about our efforts in Fairfield County, on our strategy, and we're going to be having a whole series of discussions within that region. And the final question that came forward was one suggesting that recognizing the progress we've made as one organization across the system and the agility that we've displayed, and the fact that we can do things more decisively, do them more quickly, and that we've been able to advance the system efforts throughout the past year. And the question is, how do we apply that same commitment to how we're going to engage people and be flexible for future initiatives? And to me, this is about the premise of being better than normal. Healthcare is already better than normal. It really is. When we came into this crisis, we've learned. We've learned a tremendous amount. We've made and adapted so many practices, and we've put in place so many new approaches as we've worked through this crisis. And in every other part of our life, we want our lives to go back to normal. We want our children to be in school comfortably and safely. We want to be able to spend times with our elderly comfortably and safely. And we want to see everyone's life, the things that matter most to them and the things they do, to go back to the way they've always been, but not in healthcare. In healthcare, we are not going to accept going back. We are going to address health equity, and we already are. We are going to have better infection control procedures. We're going to leverage the innovations around virtual health and telehealth to bring more care to more communities, more safely, more efficiently, and more affordably. So we're going to continue to drive this system so that the way our culture has evolved to be more responsive, to be more focused on health and wellness of our colleagues, to be more sensitive on the behavioral health needs within our communities and within ourselves. All ways we're going to be better than normal. So today's about grit and gratitude, and I just want to close by, again, ending where I began, with saying thank you. We can't say it enough. We can't figure out ways to say it effectively enough. What people have done for our communities, what you've done for all of us on the front lines of healthcare today, to call people heroes in many ways is an understatement. The inspiration, the courage, the discretionary efforts, the way this community's pulled together in this time of need. It's why our state is amongst the very top leaders in all ways that this crisis gets evaluated. We're the safety net, we're the foundation in so many ways of what occurs within our region across the state of Connecticut. And it really starts and ends with the people, our 33,000 people. So this meeting today is meant to just have transparency, dialogue, bring as much information forward as we can, as quickly as we can. And I can't wait till these meetings can be in person. But in the interim, we're going to use new ways to communicate. And these are all good ways that will also help us be better than normal. So thank you. Thank you. We are turning the corner. We're not there, and we certainly cannot let our guard down. But with the efforts of our team and everything we're doing, we will turn the corner and we will beat this, and we are on the horizon for certainly a much better day for all. Thank you so much. Thank you for joining us today.